Hello everyone, I am Dr. Shahida, Dermatologist at Kolors Healthcare. So today we are going to discuss in brief about the deep scar removal methods. So what is basically a deep scar is? Deep scar is the one which is formed because of the injury to the deeper layers of the skin. So whenever we have the injury at the deeper levels, we have a deep scar. If you have injury at the superficial level, we have a superficial scar. It's just basic as that. What are the causes for the deep scar? Among them, the few are like burns, any kind of surgery wounds, or any kind of external trauma or the injury. So now we are going to see in brief about one of them. What are the methods and what are the steps and procedure for the deep scar removal. So the first and the foremost is the subcision. Subcision is a method in which we use 18 to 20 gauge needle and put it beneath the scar to lift it by breaking the fibrous bonds. The second method is the punch excision. The punch excision is a method in which we use small punches from 1 mm to 2 mm punches and press it on the deep scar so that the tissue will get removed and it will uplift the scar. The third procedure is by using the manual derma abrasion. So manual derma abrasion is a method in which we use the corrosive materials like the sandpaper or the manual derma abrader and press it or roll it over the deep scar so that we cause a controlled injury and it will uplift the scar, giving it a nice and the aesthetic appearance. The fourth procedure are using the microneedling procedures like microneedling radio frequency, derma roller or derma pen. All this instrument will have small micro needles pertaining from 0.1 to 3 mm of diameter and which will cause controlled destruction of the tissue in a controlled fashion and will uplift and smoothen the scar. The fifth one is using the laser light. So the laser in the form of fractionated CO2 laser will emit the light energy in the form of the pulses that will cause the production of the collagen. So what is collagen? Collagen is a basic protein which is formed in the dermis or the skin. The sixth one is using a form of filler. So the organic fillers like fat fillers or the synthetic fillers like hyaluronic acid filler can cause the filling of the scar and give you a contouring and the smooth texture. The last one is for any kind of surrounding hypertrophic scar, we can use intralesional steroid injection or 5-fluorouracil to smoothen the scar. So advantages of all these procedures are we can have a smooth and contouring surface of the scar because of the production of the collagen, because all this procedure will cause injury to the skin which will lead to the healing of the skin or the tissue by producing the collagen. All above mentioned procedure will take at least of about 4 to 6 weeks of downtime to produce the collagen to have a visible result. After the procedure or any of the surgeries are completed, you have to keep yourself on the maintenance of topical creams or the gels containing alium sepa extract or the heparin sulfate, which are the active ingredients and helps in the production of the collagen. So the active ingredients like alium sepa extract and the heparin sulfate will cause the production of the collagen, which will further causes the smoothing of your skin and help to maintain the scar. As skin is the largest organ, always try to avoid any kind of external injury so that you can avoid the deep scars. And if you encounter any kind of deep scars, always consult your special doctor, specialists like dermatologists, so that you can get treated for the same.